Welcome back. We are answering your questions about the coronavirus with Moses Cone Memorial Hospital's Chief Medical Officer, Dr. Jay Wyatt. Remember, you can text your questions. The number is there at the corner of the screen. All right, so someone is asking, does the flu vaccine provide any protection against COVID-19?
No, it does not.
Plain and simple, it does not.
It does not.
It only provides protection for the flu.
That's exactly right.
All right, this person is asking, what should you do if you wear a mask and you have problems breathing while you're wearing that mask?
Depending on the setting where you are, you can vent it through the bottom or lift it up just to sort of get a couple of good rescue breaths. Won't say that it's mostly psychological because it really should not obstruct your breathing, but truly if you're having trouble breathing, you have to get to a safe space and correct it by either removing the mask and or venting it somehow.
This question deals with masks as well. Should masks be worn in office cubicles?
So that's a very interesting question because you do have barriers between you and your colleagues. However, these are not enclosed barriers. So I would say that if you're within a space that has multiple cubicles in it and a lot of people, you probably should wear your mask.
Mm-hmm. This person is asking, if someone has had COVID-19 and the last test that they took was negative, how long should it be before you interact with them?
It sort of depends on when they last had their symptoms also. So for anyone beyond, say, 12 to 14 days from when they were symptomatic and they have a negative test, they should be pretty safe to be around.
So this is a good question. Is there any way to determine if symptoms are related to COVID-19 rather than allergies or asthma without being tested?
No way to be 100% sure. I think the safest thing to do is, particularly if those symptoms related to asthma or allergies have been around for several days, is to get tested.
This person is asking, how do rapid tests work and how reliable are they compared to a normal COVID test?
So a rapid test is usually an antigen test. The less rapid COVID tests are an RNA test, which is more reliable and has better sensitivity and more specificity.
Mm-hmm. This person is saying, my 22-year-old is coming home from Texas. Should he be tested?
I think you could be safe not testing them if they are quarantined for about 7 to 10 days in the home and show no evidence of symptoms. I don't think you necessarily have to go and get tested right away. If you wanted to take them off of isolation sooner, you can probably get them tested. And testing here is pretty easy. We have a number of free local testing sites.
Yeah, the test almost sounds easier than the quarantine. In fact, someone texted that question. How do you quarantine in a house with your other kids and family members when it's so close?
It's very difficult. And in an earlier interview, I mentioned how we theoretically want to isolate family members, but that's very hard to do. And it's even harder to do when they're small kids.
Mm-hmm. I mean, I guess you could have someone bring you meals and you're staying in one bedroom and using one bathroom and not coming out for 14 days?
That's what we did with my son.
Ooh, that's rough.
We actually ended up getting him tested and he was negative, but he had been in situations where the risk was higher.
Mm-hmm. Okay. I love this question. We get it every time. If you are wearing a mask, should you still cover your sneeze with your elbow? And should you leave your mask on or take your mask off to sneeze?
Oh, definitely leave your mask on to sneeze, and that provides enough protection that using your elbow probably does not add that much.
Someone's asking, what vitamins can help boost my immune system to help it fight against the coronavirus better?
I think multivitamins, usually there's evidence out there that vitamin D helps, but I think any multivitamins and just eating healthy, it does very good.
Someone is asking, is there an initial symptom that will let you know that you have coronavirus? Is there like a first symptom?
There's not one symptom that is pathognomonic for COVID. I think the earlier symptoms generally are like a scratchy throat and then a cough, and that associated with the fever is enough to likely get you tested.
This person is asking, at what point do you feel that we could consider coronavirus managed enough to safely move into like a phase 3 reopening?
When we start to see consistent drop in the number of new cases and the death rate continues to go down, we're moving in that direction, but not quite there yet.
How safe am I if I attend a place with 10 people and wear a mask, but nobody else is wearing a mask?
So that's a risky situation if you're in an enclosed space, and probably not the safest. Unless you're wearing an ultimate N95 mask, there's still a chance that if someone is positive, you can be exposed.
Okay. And it says, should you get a test anytime you leave the state, even if you're not out in public, like stores or restaurants?
Should you get a test?
Should you get a test anytime you go out of state?
No, I don't think that's necessary, particularly if you've not been symptomatic.
All right, and this is probably going to be our last question. Is it safe to give hugs if you're wearing a mask?
So generally, that does not prevent particles that may be on clothing and on their hands from transmitting the disease once you do take off your mask. So I know people do it. I know a lot of people want to do it, but it's generally still not the best practice.
Okay, so you're saying at this point, don't do that.
No.
Okay. Thank you so much for your time. We appreciate you, Dr. Wyatt. We appreciate those of you who have sent in your text messages. We all learn something every single time that we do these Q&As.